Welcome to today's program, and thank you for joining us. I'm C. Virginia Fields, former Manhattan Borough President, and currently the President and CEO of the National Black Leadership Commission on AIDS, Incorporated. The mission of the National Black Leadership Commission on AIDS, also known as NBLCA, is to educate, mobilize, and empower Black leaders to meet the challenge of fighting HIV/AIDS and other health disparities in their local communities. Today, we will talk about the ways that nurses are helping in the fight to end the HIV/AIDS epidemic. Nurses are on the front lines of providing health care and education relating to the virus and never get enough recognition for the work that they do. Earlier this year, I had the pleasure of speaking to nearly 200 nurses who are leaders within an organization named Black Nurses Rock, which represents over 150,000 nurses and students worldwide. And here with me is Irene Treadwell, who is President and CEO of the New York City chapter of Black Nurses Rock. Ms. Treadwell is a licensed practical nurse working for a nonprofit that serves people who are homeless, mentally ill, and or substance abusers. She'll talk with us about the work that Black Nurses Rock is doing locally to address HIV and other health concerns affecting New Yorkers. So welcome, Irene. It's such a pleasure to have you with me today. And I know that we have seen each other and worked together on other initiatives, but to have you here today to talk about Black nurses' work, I'm really excited about that. So why don't we get started with just you telling us a little bit about, number one, why did you decide to become a nurse? By the way, I have 3 sisters. Well, one is deceased now, 2 are still with us. And all 3 of them are in some area of medicine, nurse, anesthetist, and I just could not stand the sight of blood. So I'm the only one who didn't move in that direction, but I did go into social work and then politics, so, you know, maybe it balances out in some way. So I respect, I applaud, and I commend nurses, because for anyone and most people have had to go to the hospitals or doctors, and it is the nurse there, the front line, so I applaud you. So what made you decide to want to become a nurse?
Well, first off, thank you for having me today. Actually, I have been a caregiver for my mom, who's disabled, for over 25 years now. And when I first started, I was basically doing, I'd say, most of the things that nurses would normally do to take care of their patients. Bathed, changed, helped her with her medications. I was her advocate when she needed assistance going back and forth to the doctor. There were some medications that she was taking that was so experimental, they were shipped directly to us from a pharmaceutical company. So I literally had to take the poster tutorial, put it on the wall, and I administer her injections myself. Took her back and forth to the doctor. And then I worked so well with her regular visitor nurse who used to come to the house weekly. And she told me, she said, you should just go to nursing school. Let's make it official. So I kind of fought it for a while. And then I said, you might as well go ahead and do it. So I went to school in 2011. I received my certificate in practical nursing from LaGuardia Community College. And then I said I would use that because I also have my bachelor's in health services policy and planning from NYU. So I guess you could say that's my calling.
That's wonderful. I mean, that's a beautiful story. And I think sometimes people don't often think about what it takes to be a caregiver, whether it's for a parent or others, and the need for respite care for those caregivers too, because it sounds like you were really 24/7 and that led you into becoming a nurse. Well, that's a beautiful story, and I'm glad that you walked into the space that obviously God had for you to be on that path. You know, sometimes we don't do it the way we're supposed to,
True.
but I'm glad that you did. So why don't you tell us a little bit about, based on your nursing experience and the work that you're doing here in the city of New York, how does that connect with HIV and AIDS, and exactly are you working specifically in working with persons who are living with AIDS or in any way?
Well, I've had experiences personally with people, my loved ones who are unfortunately no longer here, that have had HIV, AIDS. We do, obviously, in the clientele that we serve where I work, you do have some clients that will come up HIV positive. So, and then there's the twofold, because they're HIV positive and they may also have a mental health diagnosis. So sometimes you have to be mindful, are they mentally capable of understanding that particular diagnosis? And how can you go about to educate them about the importance of A, let's go in and get treated, and B, we're here to help you, so we will not leave you alone. And to get, most importantly, over the stigma associated, unfortunately, in our society with HIV, AIDS, and in particular within the African American community. So that's my niche, so to speak.
It's interesting that you would mention stigma, because here we are now, more than 30 years in knowing what HIV is and how it is transmitted, yet we find that there's still a lot of myths about it's the work that we do through NBLCA around the country.
Right.
The fact that people still believe a person can acquire the virus by sitting on a toilet seat behind someone, and the criminal laws that exist in more than 30 or so states around the country, where people are getting sentences as high as 30 years because they had sexual relations with someone and did not reveal that they were HIV positive. So it's this, despite the science, despite the research, despite what we know, there are many other myths that we encounter in our work. So I was wondering, aside from just the stigma, for example, which you certainly mentioned, what other myths might you see in the work that you do, or in the area of nurses working with persons who are living with HIV?
What's the most common one? Don't touch them, don't hug them, don't kiss them, or this is cold and flu season, so people cough, sneeze. Oh, don't go anywhere near him or her. Don't eat after him or her. Let's not share our utensils. Some people are to the point where I don't want to be in the same room with you. So I have to remind them, you cannot acquire HIV virus standing next to someone, drinking in the same area with them. Remember, we all use straws. I stress that. I don't care what you have. You don't know what the next person may have, irrespective of whether it's HIV virus or it's a cold virus. You just shouldn't share straws. Some people, if you, the bathroom issue. I remember some people work out in gyms, so they share the shower. You know, it's a communal shower.
Sure.
I said, you cannot catch that in the shower. So let's be mindful. This is 2017. Again, we know better. Let's do better. So a lot of my education is, no, that's your friend. You can go to his house. You can visit him. You can sit on his couch. Nothing's going to happen. No, you can play cards. You can play dominoes. The virus is not on there. You're not going to get it. You can only acquire it through blood and bodily fluids, unprotected sex. If the woman is pregnant, it may pass on from the mom to the baby, or if you're an intravenous drug user. I said, are you any of those? Then what's the problem?
So you're doing education every step along the way,
all the time,
every day,
because
right?
I've had quite a few clients almost break out in fights about, no, he has. I said, do you know his status? I said, more importantly, do you know your status?
That's the key. That's the question to ask. Well, the other good thing you mentioned about the transmission from mother to child, the good news is that certainly here in the state of New York, now for a number of years, we've had less than 0% of the transmission. We need to see that change throughout the country, but we've certainly worked very actively here in New York State through testing, prenatal testing, and treatment if necessary.
Right.
But that the transmission from a mother to the child and a child being born positive has certainly been addressed significantly. I remember certainly the border babies at Harlem Hospital and how Mother Hale stepped in and just made a big difference. And as you were talking, I was also remembering my first encounter, I guess, with a person who was living and at that point dying. A friend of mine, and he was in Harlem Hospital. And going there the Sunday, maybe a few days before he passed on, not knowing what to expect, we had to wear the mask, and everybody on the floor was wearing, and that was a very impactful moment. And to hear what you're saying now, as far as the myths and how people are responding, they still think things like that are necessary, huh?
It's unfortunate.
Very unfortunate, because it hinders our progress.
But I think the fear of the unknown is the biggest barrier to actually getting proper treatment. And also the fear of unknown dealing with, say, a medical provider. Because there are some medical providers that don't really understand the importance of regular. I always tell people, when you get a physical done, that's a part of your physical. That's a part of your health and wellness. That doesn't make you dirty or, shun you from society. You need a full head-to-toe assessment. That includes your full blood work. Yes, get tested. You need to know. If you are HIV positive, we have many treatments, we have support groups, we are here to help you. It's not a death sentence if you get diagnosed with HIV virus. I think that's the biggest thing. And they're still, even in 2017, go years and won't say anything to anybody.
And we often hear about health providers, and you mentioned health providers. Do you think that health providers themselves know enough? And here in the state of New York anyway, we have the law that they should do testing, routine testing. Do you think that they know enough or are doing enough to engage patients so that we can identify persons perhaps who are living with the virus sooner rather than later? What about the whole area of providers? Let's talk a little on that side.
Well, in New York, we are one of the states in the forefront, obviously, in testing and treatment. But also, it's the particular provider and his relationship with his patient or client, because some people might say patient, some might say client. Some providers feel like they might be a little intrusive in asking, should you get tested? Others feel like that's I took the oath, that's my duty to make sure that you have a total health and wellness. And I'm going to stress that if you do not want to take that, then that person has that right. And then we're talking about generations. Because you might say, well, she's 20 to maybe 30 or 40, I'm going to ask her to get tested. And I say, well, everybody should get tested, even great-grandma. And then some providers feel like, why would I even ask her to get tested? I say, why not?
They're making judgments.
You
don't have sex
after
50.
Right. And I say, let us not forget that a person's sexual health, sexual lifestyle doesn't die at 50. They can have healthy, productive sexual lives all the way till the day that they die. Why should you not include that in the overall testing? So I think that's one of the biggest. And then,
so what do you think we need to do with providers? Because you mentioned several things. Some is generational, some feel that they're being intrusive, some just don't and they look at certain people, and because you are well dressed, you have an education, there is no way that you could possibly be positive, so they don't even bother to test you or to talk with you about it. So what do you think in terms of your field that you're in, what we could do to help providers better understand the role that they can play and can be more helpful?
Well, again, education, education, education for the providers. Number one, we need a cultural education. We need for you to get over your personal biases about the clientele that you serve. Because remember, I work in the Bronx. Some people in that particular section might feel, oh, you know, because some of those folks have a high risk, either past behavior and or present behavior, they should be more susceptible to HIV virus. I said, that's your personal bias. You must get over your personal bias. So we have to help you work through that. And then we have to remind you, you are here to help them get better, live better. So why are you not stating to them, you need to get tested? So I think, again, you need to go either in groups, in a conference nationally with the Board of Health, reach out to the providers. We need you to be the leaders in the forefront, because the patient or clients 9 times out of 10, you know, my doctor said.
They will listen to
Right.
the doctor, and they will listen to the clergy.
Right.
That's why we work so much
together.
Right?
And then we have to remind the doctors, let's find a particular way to deliver the message.
Yes.
I said, because if you deliver the message the right way, you can have your patient or client do whatever you would like for them to do.
Now, the other thing we're finding, what experience are you seeing in this regard with PrEP, pre-exposure prophylaxis? And of course, we did a study with focus groups with some younger Black gay men, and we're waiting to release that study after we go through the review process with the state. But it's very clear that the population where we're continuing to see disproportionate increases, Black gay men, Black men who have sex with men, and younger Black gay men are not using PrEP. Yet that is one of the major 3 areas, focus areas of the governor's plan to eliminate the epidemic.
Right.
So how are we going to be able to do more around talk? And I'm hesitant to say encouraging people to use PrEP, because at the end of the day, I think that's a personal decision.
Right.
But I do think that we have to do more around education. Are you seeing anything in your area with respect to PrEP?
In my area, it's little outreach. Like, let's come out into the community and bring it to them. Let's not wait for them to come into the doctor's office or one of the sexual clinics, or go to the make the request to the New York City Department of Health and Mental Hygiene. You need to actually start the car and bring it out to them. And I always say, if you have to go to a bar or a club where you know the clientele is young, gay, multicultural, whatever, then you go there. You meet your client or patients where they are. So I think that's key, to go where they are, and then put the information out where they can understand it. But as far as the PrEP is concerned, there are some, I have seen some that will say, well, if I take it, I won't get it. And I say, well, first of all, you will go to your doctor, you will make sure you are HIV negative, so you have to get tested. And then you explain with your doctor, and you have to be honest, because you have to be open and honest with him in order for him to help you, him or her. Then you will get your prescription. You can go out, but remember, you should also use a condom. You can't just take this pill once and then don't take it again until next week.
Right.
I said it does more harm than good. And then so you must also follow up every 3 months with your provider to get your next HIV test, to explain to him, well, how you feel, how did it go, do you have any side effects, and then work from there. But remember, practice safe sex.
Well, it sounds like what you're doing as a black nurse is very much a part of what we do in terms of education. And I like to say a lot that education, perhaps in prevention, is much harder in some instances than treatment, meaning that you have to say the same thing over and over, at least if a person is on medication. Over a period of time, one should be able to assess if they're making improvement or if the medication needs to be changed for a better quality of health. But in education, it is extremely hard, and I'm just delighted to hear you talk about needing to go where the people are, where they live, where they congregate, where they worship, because that's very much a part of our work, and we're so delighted to now have a working relationship with your chapter here in New York City. So talk a little about what that is, even though I know it is still evolving.
Right.
And what would you like to see that be?
Well, I'm one of those people who put the shoe on, put the foot down, and let's go. We have work to do. So I'm claiming it that we will work together to go forth in each and every neighborhood to get the word out. Number one, get tested, know your status. And if you are HIV positive, we are here to help you. There is no stigma. You don't have to feel ashamed. And we look like you. You look like me. I think that's also important too, to have the face, a familiar face. And then remember the familiar age, because there are some people, I'm 50, there are some people who are still living and striving, who are HIV positive, who are 50 and plus. There are some people who will be newly diagnosed at 50 and plus, to let them know, and we're here, you need a support group, we can do that. So that's my ultimate goal with NBLCA and BNR NYC, that we're just gonna team up and get the ball rolling.
Well, we're excited about it because we know the possibilities that exist and around the country as we work with Black Nurses Rock and other organizations in your sororities, your fraternities, your Masons, and all of these civic groups, but certainly the faith-based organizations. Getting that message out is probably the most important thing that we can do in our community.
Right.
So I'm happy to hear about the partnership that we're forming with you here locally and look to be doing across the nation. So for the last few minutes that we have, let's talk a little about what's next for Black Nurses Rock, both locally and nationally. And how old is the national organization?
The national was established as a nursing organization in 2015.
So you are very young.
Yeah.
Okay.
Well, you know, we're getting there. So right now we have 47 chapters nationally. We have affiliates in Canada, Japan, and the Bahamas. We have 4,000 official members nationally. We have over like 170,000 people on our Facebook page. We have about 44,000 likes on our Facebook fan page nationally. And then locally, our chapter, May of this year, will make 1 year for us. So we have 28 members and counting. And on the national level, we are, as well as working with you and going forth with our HIV/AIDS initiative nationally, on the local front, it's NYC and NBLCA. We also work with the New York City Department of Health and Mental Hygiene with the HIV/AIDS New York Knows Initiative. And we will begin what's called NFL, Nursing Future Leaders. That's our national program. We are going.
No, I'm glad you explained what that is.
I know, because when people were like NFL, we are going to go.
Well, they could probably benefit from some insight from the Black Nurses Rock, the NFL.
But that's our initiative to go forth, and we need to, in order to have a strong tree with solid roots, you have to plant the seed first. So we're going to go forth as young as 5 years old and up to teach them the importance of education, first and foremost, And then naturally, you want to be a nurse. You're going to be a nurse, you're going to be a leader. You're going to be in the forefront for our future generations and our future communities. And then we also have our Goal Mates program, because we have...
What's the Goal Mates program?
For our young brothers and sisters who are either in their last year of nursing school, or who have graduated and have their license, and they're just starting out as new nurses. We want to be your mentor, your preceptor. We want you to know that there's somebody there. So what you're experiencing, you don't want to freak out. We're here to help you. So that's just some of the things on the local and national level that we're working on.
Well, I'm excited. I'm excited just hearing you and with the possibilities and knowing again the roles that you play in the field of medicine overall, whether it's in private offices, in large institutions, in hospitals. You make a difference, and it matters having you there. So I thank you so much for joining me today and sharing with us and the viewers about what it is that you're doing. Black Nurses Rock. And I love your shirt, by the way.
That's my shirt.
It is absolutely fabulous. So to our viewers, we want to say that for more information about Black Nurses Rock is at blacknursesrock.com.
That's right.
And learn about NBLCA at our own website, NBLCA.org. Also look for NBLCA on Facebook, Twitter, Instagram, LinkedIn, and YouTube. The Manhattan Neighborhood Network brings these programs to you to better inform the public, you, the viewer, about the important topics that impact your health and well-being. So please let your family, friends, and neighbors know about this programming. And I'm C. Virginia Fields. Thank you for joining us, and hope you'll tune in next time for NBLCA's Health Action TV right here on Manhattan Neighborhood Network.